broke his camera.
Good afternoon, everybody, and thank you for being here. And I also want to thank all the folks across Louisiana for tuning in, wherever they might be. As usual, I'm joined today by Dr. Joe Canner. He will go into a great more detail on the COVID-19 situation in our Louisiana, and here in Louisiana in just a moment. But to start things off on a couple of positive notes, you may remember that a few weeks ago, Dr. Canner told you that he and his wife were expecting and that she had gotten her vaccine to protect herself and their child. And I am able to report that that child, Levi, has been welcomed by Joe and his wife, and he is very healthy and doing well. So congratulations to you, Joe. And on another positive note, before we get into some less positive things, we announced 2 more winners today for Shot at a Million. And I was able to make phone calls to both of these winners earlier today. The first was Miss Edwina Jones, a 65-year-old resident of Marrero, and she won the second $100,000 cash prize. Also was able to call Mr. Andrew Holman, a 14-year-old, soon-to-be freshman at North Shore High School. He lives in Slidell, and he was the winner of the second $100,000 scholarship. I thank them both for being vaccinated, first of all, to protecting themselves and their families and their communities, and then I was certainly able to congratulate them as well. And I'm appealing to everyone every day to be more like Edwina and Andrew if they haven't yet done it. And you can also be like them and register for the lottery. And if you do that, you then have a chance to win as they have. And of course, we do have the $1 million grand prize that's coming up in just a couple of weeks. Now, for the less positive news today, as you are probably well aware, we are having this press conference today because Louisiana is undeniably in a 4th surge of COVID. On Wednesday, we reported the 3rd highest daily case count since the start of the pandemic. Today, we are similarly reporting a very high number. 3,127 new cases of COVID-19. The number of new cases diagnosed each day in Louisiana has been increasing since June the 16th and is now increasing in all regions of the state, just like numbers are increasing in all 50 states of our country. But the statewide average of daily cases per 100,000 residents has increased 208% over the past 14 days, and Louisiana now has the highest growth rate in cases per capita in the United States of America. I want to let that sink in. We have the highest growth rate of new cases per capita of any state in the United States of America. Just this week alone, since Monday, and including today's announcements, we've added 16,898 positive cases of COVID. And we know that more than 80% of these are the Delta variant. That is what's causing this surge. And what's enabling the surge is the very low percentage of people who have been vaccinated and have conferred upon themselves the protection that the vaccines offer and that nothing else offers them. Statewide percent positivity of new COVID-19 tests conducted now is at 8.7%. That's up from 6.3% last week. And I have no fear of contradiction that next week we will be reporting positivity that exceeds 10%. The number of patients hospitalized in our state with COVID-19 has been increasing since July the 1st. Since that time, there's been a net increase of 749 more people in the hospital. That's nearly 4 times the number of people who were in the hospital just a few weeks ago. We were down to around 240. Today we reported 1,008. In addition, we have 82 patients on mechanical ventilators. That is up 17 just from yesterday. Right now we have about 40% of our people who've taken at least one shot. That is nowhere near where we need to be. Of those eligible, those 12 and older, we're just shy of 48% of Louisianans who've taken at least one shot. Again, that number is far below where we need to be to have the protection that we need in order to slow the spread and move towards ending the pandemic. And you remember early on in the pandemic that it was the congregant settings like nursing homes and prisons and so forth that had the largest number of COVID cases. But I will tell you, and I think this is tremendous evidence for the efficacy, but also the safety of these vaccines, that because of the large percentage of residents who are in our nursing homes who are vaccinated, there are virtually no cases among residents in Louisiana. And this is despite the fact that just about every single resident in a nursing home is more vulnerable to the disease, and they live in that congregant setting. And so let me just pause for a second and remind everybody in Louisiana that today there are more than 1,400 locations where you can get vaccinated. It is free, will not cost you anything out of your pocket, and it just might save your life. I encourage people to call 211. They can tell you when, where, and how to get vaccinated. You can call the hotline, 1-855-453-0774. And you can go to covidvaccine.la.gov. Again, there are more than 1,400 locations. And if you're homebound, you can call that hotline and we'll come to you. If you've got an event at your church, or if your place of employment is wanting us to come to vaccinate employees, we're happy to do that. By choosing to take the vaccine, you choose to protect yourself, those around you, and if you have children under 12, please understand they don't have this as an option. And I think we have a special obligation to protect them. But if you choose not to be vaccinated, I can assure you, and the numbers we just went through fully attest to this, you run an unreasonable risk of becoming infected, getting sick, going into the hospital, and dying. A year ago, we didn't have these vaccines. And we all looked forward to the day. We prayed that that day would come quickly when we would have safe and effective vaccines to help us get the pandemic under control and to save lives. The overwhelming majority of those who are getting sick, going into the hospital and dying from COVID today, are unvaccinated. I'm sure that Dr. Cannon will have some more information about this, but it is over 90%. Simply put, we have the tools to prevent this from happening. And even though Louisiana has the fastest growing trajectory of COVID cases per capita in the country, we are ordering about 10% of the vaccine doses available to us, because that's all we need to administer doses to those people showing up to be vaccinated. So I want you to think about that. We're ordering 10% of the vaccine doses available to us. And yet we have the highest growth rate in cases in the country. That has to change. And it has to change now. The White House has listed Louisiana as a state of concern because of the surge that I have been discussing with you. And in just a few moments, you're going to get more data and more information about the Delta variant and why it is so concerning. But before we go any further, I'll answer a question that I know is on your minds, especially since I walked into this room today in a mask. Because of the troubling trends, we are issuing some updated additional guidance today to the public. First of all, we're recommending that all people, vaccinated and unvaccinated, mask while indoors if 6 feet of physical distancing cannot be maintained. Second, we're asking that businesses review their operations and accommodate employees in a way that limits contact and potential COVID exposures. Third, we recommend that all people, even vaccinated individuals, test immediately after a known or suspected exposure to COVID-19. If positive, you should isolate immediately. If negative, you should retest again between 5 and 7 days after the exposure, or if you develop symptoms, you should test immediately pending the results. And for individuals who test positive and have symptoms, you need to see your medical provider right away, because one of the best tools that we have to preserve hospital capacity is an infusion, monoclonal antibody infusion that has to be administered very shortly after the onset of symptoms in order to be effective. And effective means you don't then progress in your disease to a point where you need to go to the hospital, which is important, because if you don't need to go to the hospital, then you also are not going to die from COVID. These are the 3 things that we are recommending now. Additional guidance may come later. I have updated my public health emergency order on COVID, and on Monday, executive branch agencies will begin requiring masks for state employees. The Division of Administration will issue additional working guidance on Tuesday. Now, it is true, and I think Dr. Cantor will get into the specifics of this, that the new recommendations do differ slightly from current CDC guidance, which says that you don't have to test if you are vaccinated and asymptomatic even after an exposure. And I think that that was good guidance until we started surging. And even today, that may be good guidance for most states, but not the state that has the highest growth rate of cases in the country. So we are at the tip of the spear of the surge. And as you can expect, the CDC looks at the country as a whole. So that guidance doesn't currently take into account the rate of surge that we're seeing in our state, and therefore I've elected to take action on the guidance that has been provided to me here in Louisiana by the recommendations of our Office of Public Health, led by Dr. Cantor. In fact, Because of our low vaccination rates, because of the prevalence of the Delta variant and our surging cases, the CDC is looking to Louisiana right now to gather the data that it needs to make decisions as a whole for the country. And of course, we are more than happy to be working with them to provide that information. We've always relied on the CDC for guidance, but we've also always tailored those recommendations for what was happening here in Louisiana, and we're doing that once again. So to sort of sum it up, with the Delta variant, which is obviously more transmissible, more virulent, and because of our low vaccination rate, because of the summer season, with school about to start, both K through 12 and higher education, this really is the perfect storm. And the conditions are ripe for catastrophic outcomes for far too many individuals and families. We're also in hurricane season. But unlike hurricanes, this is a storm that we can control. We're not powerless. How many times have we seen that storm coming across the Atlantic or into the Gulf or up from the Caribbean, and we say a prayer and we try to pray that storm away from us? Nothing wrong with that. But we can do a whole lot more than that with this current perfect storm of COVID. We can be vaccinated. And we can all take care of ourselves through these relatively gentle mitigation measures that I just talked about. Get our vaccination rate up as we do that. And by the way, we've already had 3 surges. This is the 4th one. I know that we can rise to the occasion. But let's don't just rise to the occasion of this surge. Let's put this pandemic behind us and have people vaccinated. And so on the one hand, this is hard work. On the other hand, it's pretty simple. So let's dust off our masks for the time being and focus on getting more people vaccinated. And speaking of hard work, in addition to doing this for yourself and your family, your community, your coworkers, think about the doctors, the nurses, the EMTs, the respiratory therapists, who have been battling this pandemic since March of 2020. Know that they are exhausted, physically exhausted, emotionally exhausted, and in many cases they are working shorthanded. Do it for them too. And there are so many reasons to be vaccinated, because we know that we're dealing with the Delta variant today, but the more transmission that occurs, the more likely that Delta spawns yet another variant in the future that could actually be worse. It's hard to imagine being worse, because indications are the viral load that you get from infection from the Delta variant may be 1,000 times higher than it was from the previous variant. But if we don't want to risk more variants than is absolutely necessary in this pandemic, we have to slow the transmission. Another great reason to be vaccinated, so that we can get the transmission back under control. And I know you're going to have questions about the Delta variant, breakthrough cases, what makes this surge different from previous surges. And I will tell you that this can be a very confusing topic. There are probably not many people in the state who spend more time than I do every day or every week trying to stay on top of this, whether it's phone calls with the White House or the CDC or the meetings we have here. It's everything that we can get our hands on. But the good news is on that front, we have Dr. Joe Cantor to explain it to you. And so I'm going to ask Dr. Cantor to come up now, give you some additional information. I would ask that you ask your questions of Dr. Cantor while he's up here. And then once he concludes with those questions and answers, I'll come back up and make a few more comments and then take some questions. Joe?
Good afternoon. Sir, on behalf of Secretary Phillips and the Department of Health, we want to thank you and appreciate your continued leadership through this. And personally, on behalf of me and my wife, thank you for the well wishes, although we certainly wish it was lighter times. Governor covered a lot of pertinent data points there. I'm going to try and go in a little bit more detail. We are clearly in what is still the upswing of now our fourth surge of COVID-19. And we have not really seen any signs yet that it is slowing. We're very much in the upslope, and that is not a comforting place to be right now. The slide that you see right here is a typical four-factor slide that we show every time that we get together and review the data points. We looked at this about 1 week ago, and I'll review it again right now. On the top left, you'll see a graph of the percentage of ER visits that are attributable to what we call COVID-like illness or symptoms suggestive of COVID. And I'll review what those symptoms are because it's been a little bit of time since we talked about it. Cough, fever, shortness of breath, malaise, which just means feeling bad or run down, nasal congestion, sinus drip, feeling like a URI, flu-like symptoms. Those are, generally speaking, the symptoms of COVID. And again, of course, people can have COVID and be infectious without having any symptoms at all. But we measure how many people come to the ER with these type of symptoms. If you see on that upper left-hand graph right now, we are now at about 8% of every ER visit in the state is someone coming in for care because they're experiencing these type of symptoms. Not all those people will have COVID, but many of them will. That is a little bit less than the peak that we had around Christmas and New Year's, but you'll notice it's higher than the peak that we had about a year ago, July and August of 2020. And that was a very bad peak for us. We've now exceeded that in terms of the amount of people coming in to the hospital with these type of symptoms. There are other viruses circulating too, particularly RSV, and that's keeping hospitals busy as well, and that's compounding the challenge right now. On the top right-hand side, you'll see incidence. This is the number of new cases of COVID diagnosed every day, smoothed out over a 7-day rolling average. We've now been at a steady increase for the past 30 days, and that increase is seen not only statewide, but in each of our 9 regions. We now have 175 new cases of COVID per 100,000 residents per 7 days. That's a standard measure that the CDC tracks. Anything over 100 is cause for grave concern. That number nearly doubled in the past week. It's also gone up over 200% in the past 2 weeks. The CDC looks at risk of community transmission by taking 2 factors into account. What's the amount of new COVID being diagnosed every day, or the incidence, and what is the percent positivity of tests being done? They put that together to a risk category. There's now not a single parish in the state that has a low risk of community transmission of COVID. On the bottom left, you'll see the purple line is the volume of testing being done, and as you would expect, that testing volume has gone down steadily from that December, January surge, and is now over the past 2 weeks picking back up. The bottom orange bar graphs are percent positivity. As the governor said, this week percent positivity went from 6.3% statewide to 8.7%. We have not been that high since January 13th. We've effectively lost 6 months of progress over the past 2 or 3 weeks. And I'll also note that over 1/3 of the parishes in Louisiana are now above 10% positivity, which is extremely alarming. On the bottom right, you'll see the number of people hospitalized with COVID-19, currently inpatients in hospital beds across the state. And this is probably the graph that gives me the most concern right now. We have almost quadrupled the number of hospitalized COVID patients in the past 3 weeks. We were at just over 250 about 3 weeks ago, and we're now, as the governor said, at 1,008 hospitalized patients. That is superimposed of 2 acute stressors facing hospitals right now. Number one, they're busy with other stuff. There's a lot of RSV going around. There's a lot of parainfluenza going around. Hospitals are busy caring for other sick patients, busier than they normally are this time of year, even taking COVID out of the picture. And the second acute stressor challenging hospitals is staffing. And as the governor has mentioned a couple times now, hospitals are having a hard time retaining and recruiting new nurses, and it's for very understandable reasons. This has been such a challenging year for people on the front lines, and a lot of nurses have taken the opportunity to pursue non-clinical work or travel nursing opportunities or go back to school or just take a break, which is certainly understandable. But it's hard to staff all the available hospital beds right now, and that's limiting the capacity of our hospitals to provide care right now. Go to the next slide, please. We show this chart every now and then. It hasn't changed from when we show it last week. When we look at COVID-like illness, when we look at new cases, and when we look at hospitalizations statewide and in each of our 9 regions, it is increasing. Again, we are in the upswing of a 4th surge. We have not yet seen any signs that it's slowing. Very difficult to predict how high this will go, how long it will last. Flip to the next slide, please. We wanted to compare a little bit what's happening here with what other states in the country are seeing. You'll notice us, Missouri and Arkansas, really are seeing the brunt of this national outbreak right now. Other parts of the South, Mississippi, Alabama, Florida, and some Texas as well. But really focused on our part of the country, we're truly experiencing a perfect storm right now. Number one, as Delta variant has swept across the country, it was here in greater numbers first. We've now come pretty level to what the national numbers are. Nationally, 83% of every new case of COVID-19 is estimated to be Delta, and in our part of the country, that's 84%. But we were well ahead of national measures in the preceding 3 weeks. As the governor said, the best estimate right now is that Delta causes people, when it infects them, to have up to 1,000 times higher viral load than the previous types of COVID. That means you have up to 1,000 times more of the virus in your body. That likely explains why it's so transmissible, why it's spreading so quickly. It also likely explains why we're seeing worse outcomes and why we're seeing kids get sick in higher numbers than we ever have before up until this point. This is the perfect storm. I'll add to this, the second reason why we're being hit so hard is we have low vaccination rates both in our state and our neighboring states. That means we are not protected. We are not protected against what Delta is bringing right now as a population. I think people that are vaccinated do have a great degree of protection. As a community right now, we are very porous. And third, what happens down here in the summertime is analogous to what happens up north in the winter, which is the weather drives people indoors. And today is going to be another really hot day. When people go indoors, it's just easier for the virus to spread. So when you put those 3 things together, we are in a perfect storm right now. And as the governor mentioned, if you go to the next slide, please, we are the leading state in the nation for COVID-19 right now, as measured by the CDC, looking at new cases coming in, average over the past 7 days. We unfortunately have been the leading state before, and it's not a great place for us to be. It is pouring down rain, and we're taking in water right now. I do want to talk about what we're seeing in terms of the people that do test positive with COVID-19. And let me just say this before I go into these stats. The 3 vaccines that we have right now, and this has been confirmed with numerous studies. In fact, a good study produced in the New England Journal of Medicine just this week. The 3 vaccines, the Pfizer, the Moderna, and the Johnson & Johnson vaccine, provide excellent but not absolute protection against COVID-19, including the Delta variant. Excellent protection, even with the number of breakthrough cases that we're seeing, and we'll talk about that in a second. Excellent protection, but certainly not absolute. Of all the cases that were reported to the Department of Health last week, 92.7% were in people who were not fully vaccinated. Of the 1,008 hospitalized patients today, right now in hospitals across the state, 90% of them are not fully vaccinated. Of all the COVID-19 deaths that were reported out by the Department of Health over the past 7 days, 91% were in individuals who were not fully vaccinated. 9 in 10 people in a hospital bed right now with COVID are not vaccinated. That's pretty powerful when you think about it. Let's talk about that 1 in 10 who are vaccinated and have a breakthrough case. By and large, breakthrough cases are rare, statistically rare, but as you can see from those stats, they certainly do happen. When we see breakthrough cases in people who are fully vaccinated, more often than not, they are mild or they're actually asymptomatic. When we see the rare breakthrough case that does cause serious complications, like a hospitalization, it is more often than not in an individual that is at increased risk for complications themselves, such as people of advanced age and people that have serious underlying comorbidities. Of all the serious breakthrough cases that we have seen, this means hospitalized or even death, the median age, the average age is 73 years old, which is what we would expect because older people usually have a less robust immune response to a vaccine, and certainly they're not as able to fight off a serious infection. We will see breakthrough cases. There is absolutely no question about that. And to be completely transparent, the number of breakthrough cases that we will see will go up as the amount of COVID in the community goes up. When someone is fully vaccinated, they have a very, very small chance of having a breakthrough infection, but that chance goes up slightly as they get exposed to COVID more. The more times you are exposed to COVID, if you're fully vaccinated, the chance that COVID is going to break through that protection of the vaccine will go up. So as cases go up, we do expect to see more, but make no mistake about it. The vaccine provides excellent, excellent protection, and more often than not, much more often than not, when we do see breakthrough cases, it is thankfully people that have mild symptoms or asymptomatic. There is absolutely no question right now that your best ability to prevent getting sick, severely sick with COVID, being hospitalized or dying from COVID, is to get vaccinated. There is absolutely no question about that. Last week, you heard from Dr. Catherine O'Neill, the medical director of Our Lady of the Lake Hospital System. You heard some very impassioned remarks from her, and she's an individual. She's one of the most sincere, intelligent, and compassionate docs that I know. And she pleaded with the state of Louisiana to take note of what is happening in hospitals now and act now to protect yourself. I spoke with her today again to catch up. She let me know that the resources of her team are stretched uncomfortably thin. And I've heard from numerous clinicians across the state this past week that they continue to see patients sick with COVID who are not yet fully vaccinated who tell their doctor and nurse that they wish they had chosen to get vaccinated earlier. If you want to ask yourself, when's the best time to get vaccinated? Really, it was about 5 weeks ago. When's the second best time to get vaccinated? Right now. Right now. Because we do not know how long this surge is going to last. The governor mentioned children, particularly children younger than 12. He also mentioned that from this podium 2 days ago. And children younger than 12 do not have the option of getting vaccinated right now. So we must protect them. Our vaccinations and the vaccinations in people around our children will protect them. That's the essence of how herd immunity works. We must get vaccinated, protect our children. I now have 2 children that are not yet able to get vaccinated, and that's on my mind every day right now. We think about that a lot as schools are preparing to come back into session for the fall semester, and the clear consensus recommendation right now is for people to mask when they are indoors and unable to distance. That will create a safer environment in schools. You saw last week the American Academy of Pediatrics came out and said that exact same thing. And so that is a very clear recommendation. There will be robust testing resources made available to every school in the state. These are made possible through grants that come to the Department of Health, through the CDC, and any school that wishes to make COVID testing available to their students and staff will have those resources made available to them. But we are cognizant that schools must do the right thing and work hard now to create a safe environment for their students, which, by the way, will also limit the amount of absenteeism, which will make it so that they can continue to have in-person education with minimal disruption. Go to the next slide, please. If there is any good news in this, it's that we have, over the past 2 weeks, seen an increase in the number of people who have initiated their vaccine series, the amount of vaccinations being given over the past about a week and a half to 2 weeks. We've gone from an average of 2,000 new vaccine administrations. These are people that initiated, start the series a day, up to about 5,000 a day. So that is encouraging. I'm sure some people are paying attention to the cases and are rightfully concerned. I'm sure people are also paying attention to what the state is doing, the Bring Back Louisiana campaign, the Shot at a Million campaign. It is encouraging to see those numbers go up. As the governor mentioned, we now have just over 40% of our state has at least initiated the vaccine series. That's about 1.9 million people, just shy of 1.9 million people. Nationally, there's been 339 million doses of vaccine administered. That's about as large a sample as you can get. And if you continue to have concerns about the vaccine, I really do encourage you to talk to your doctor and take stock of the 339 million doses that have already been administered across the country. You need to be completely honest with you. It is discouraging to be back in this situation again, in a very dangerous surge and leading the country. So much so that the CDC is looking to the data collected in Louisiana now to help inform any revisions to their guidance that they might make. Revisions, I'll add, that would be to the benefit of other states that may experience this surge in the coming weeks or months. If there's any solace in that, as the governor said, we've been here before. We've been here 3 times before, actually. And so we know exactly what we have to do. The recommendations that the governor made will keep you, your family, and your community safe. Because we're taking in water right now, and we've got to start bailing. So you will be safer if you mask and distance when you are indoors. You will be safer if your business takes time right now to review appropriate accommodations. That means seeing what they can do to decrease the density of people in the office at any one given time, increase the masking in their facilities, and increase the distancing. And you will be safer if, despite being fully vaccinated, you now go get tested should you be exposed to somebody with COVID-19. or suspected of COVID-19. I don't think these are going to be the recommendations forever, but we need to be cognizant of while we are in a surge, we need to be acting differently. And these will keep us all safer and hopefully, we all pray on this, minimize as much suffering as loss as we will have as we come through this very, very dangerous surge. So, be happy to take any questions that are directed to me before the governor comes back up. Yes, ma'am. I don't have the exact figure for you right now, but it's challenging to get good conclusions when you look at that, and I'll explain why. Number one, the number of people who have taken each of the 3 vaccines is not equal. It's not even close to equal. For example, many more have taken Pfizer and Moderna than J&J. And the other reason why the risk profile of individuals who have taken a certain type of vaccine is not equal either. For example, nearly every nursing home resident who's the highest risk for complications had Moderna, because that's what the program was. So it's very challenging to look at those numbers and glean any type of conclusion like this one is more protective or not. The best data at hand is really all 3 of the vaccines provide pretty good protection. I mean, against Delta 2, and I'll remind, we kind of get caught up in this 88% versus 95%, 94%, but in the world of vaccines, getting above 75%, 70% really is a grand slam. And there's just not a lot of vaccines out there that are that effective.
So y'all do track those numbers, though?
We do. The team goes through them. It's challenging to draw conclusions from them.
Is that, last question regarding that, is that why y'all won't release it? I mean, if they are doing well and you showed the percentage of breakthrough cases, why aren't y'all releasing those numbers? Or is there a reason you're not releasing them?
No, they will be released. I think the team's just cleaning up the data. So, yeah. Yes, Julie.
Someone has COVID 100 feet from me, does that mean I was exposed? I don't,
Yeah, so the technical definition from the CDC is an exposure is if you're within 6 feet of someone who's positive for a cumulative 15 minutes or longer, which can be added up over a day or something like that. Now, of course, anytime you take a firm guideline like that, it's not black and white. It doesn't mean that if you're 7 feet from someone, you're 100% protected. So when people are concerned about an exposure and they talk to the contact tracing team, they typically go through risk-benefit and make a reasonable decision of what the best course would be based on the facts. I think if anyone is concerned, I mean, the bottom line recommendation is if anyone is concerned that they were potentially exposed, whether they were 3 feet from someone, 6 feet or 10 feet, whether they're with someone for 12 minutes or 2 days at a time, if anyone is concerned, the best advice right now is to go get tested, and not just once. Get tested immediately after you know about it, which would be day 0, and again between days 5 and 7.
Do you think that guidance is going to change because the Delta variant is more contagious?
Yeah, I think it's possible. I think there's a number of, from the CDC, I think there's a number of guidances that, is actively being looked at. That being one, the recommendation from the CDC of who needs to quarantine after an exposure, and then the testing guidance. They're looking at all of that, but I think what's challenging for us in Louisiana is we are, unfortunately, the leading edge in the nation for this surge right now. So any data that's going to inform the CDC is going to come from Louisiana, and we don't want to wait around for that. Yes, ma'am.
One of the things that I've heard anecdotally is that when some people have tried to, who are vaccinated, have tried to schedule a test, if you are vaccinated, you enter that you are vaccinated, the pharmacy will stop you from being able to schedule a test. And so I'm wondering if that's the case, and if people have to then say they're unvaccinated to schedule a test with that particular pharmacy, does that skew the data that y'all are collecting about breakthrough cases?
For the second part, I don't know. I'll have to take a firm look at how often that's happening, if it's skewing the data. For the first part of that, that's wrong. I'm not saying what you're telling me is wrong. I'm saying if that is happening, that's wrong. Anyone who is concerned about an exposure should be tested. And I think that's probably, we'll take that back, Melinda, and double down with messaging to our providers, clinicians across the state, because we could not be clearer. Anyone who is concerned because they had an exposure or for any other reason needs to be testing, and that testing should be widely available. So thank you for raising that. Yep.
Piggybacking on their questions, I've had a lot of people ask me the last week or so where they can go get tested, and the locations haven't really been given in the past few weeks because the numbers were down so much. Are y'all going to issue like a refresher on where they can go tested, aside from pharmacies? Will there be sites that will be placed? Will there have to be doctor's orders in order to get tested? Like, what are y'all thinking about it?
Testing sites are available on our website. Excuse me, they've been available throughout the pandemic, although it's certainly more pertinent right now than it was a month or two ago. No doctor's order is typically needed, and I'll say most pharmacies right now, commercial pharmacies, offer not only the vaccine but testing as well. Yes, sir.
Kind of along those same lines, do you believe that we are testing enough to get a good, accurate picture of how much COVID is out there?
I do. We talk about this a lot. It's something that we want to make sure of. I think if we were not testing enough, we would see a significant rise in percent positivity that doesn't correlate with a rise in incidence or new cases. And if your percent positivity goes up much more than your new cases go up, it's a message that you're not doing enough testing. When you see commiserate rises, our percent positivity has gone up, pretty much commiserate with the amount of new tests going up. It pretty much shows that from a population standpoint, you're doing enough testing to get signal, meaning that you have enough visibility, you have eyes on the pandemic, what it's doing. Now, from an individual standpoint, individuals need access to testing and need the knowledge and to know, when and where to go without question. So what we're really trying to communicate now is if you were exposed now, or if you're concerned for any other reason, if you were perhaps not getting tested previously because you were vaccinated, we're now asking you to actually go get tested. But I do think we're doing enough testing from a public health standpoint to have accurate visibility on what the pandemic's doing. Yes, ma'am.
The guidance has always been if you're unvaccinated, you should avoid crowded spaces, both inside and outside. But if you are vaccinated, and due to the high level of Delta in our state, would you suggest that people avoid crowded spaces?
Yeah, I would. And again, not forever. But we're in a surge right now. We're in a really bad surge. And so we've got to buckle down and mitigate our way through this surge. So I would certainly recommend everyone vaccinated or unvaccinated, mask and distance when they're indoors, which is what the recommendations is. And just like you mentioned, I would recommend avoiding crowds if you can right now. And I would particularly recommend that for people that are at risk for more complications, people that are older, and people that have serious underlying conditions. I think the mentality that we have needs to flip to now we're in a surge. Now we're in a surge, and now we have to buckle down and do all the mitigating measures that we know work, and we know that because it got us out of 3 previous surges. Doesn't mean it's going to be forever, but we got to do it now to get out of this thing. Yep, and last question.
The CDC is looking at a third booster shot by Pfizer to combat the Delta variant. How ready is the state to recommend and distribute the vaccine once it's authorized?
Yeah, very ready once the FDA and the CDC respectively authorize and then recommend that, but that hasn't happened yet. The CDC's Advisory Committee on Immunization Practice, the ACIP committee, met yesterday to talk about that amongst some other things, and they actually didn't draw any firm conclusions. So there still are trials out there, there still is data coming in. The FDA and the CDC have already looked at the data that the Pfizer company has. They looked at data from Israel. They've not yet made a decision on that. And the decision might not be a general recommendation. It might be the recommendation tailored to certain people who are at higher risk. And they might eventually say, you need a booster if you are over this age or have these underlying conditions. The second they do that, we will be ready to offer that throughout the state. Thank you.
Thank you, Dr. Kenner. And I'll say again, the state is very fortunate to have your services right now and that of the team at the LDH and the Office of Public Health, and then all of our medical professionals around the state. To get back to a question about whether we're doing adequate testing, I think with today's test numbers included, we've conducted about 330,000 tests in the month of July, and we're on a pace that will get well above 400,000. That's twice as much as the minimum amount that we were told was necessary to keep a good gauge on what's happening in Louisiana. And it's true that the more COVID activity you have out there, the more testing you do. And so I would expect that the number of tests that we do over the next several weeks will continue to increase. So I think we can all be confident that we have a good handle on what's happening, but what's happening isn't good. So we've talked a little bit about the challenges with respect to the capacity to deliver health care, and the hospitals are already working very hard to take care of the patients that they have that are not COVID related. The share of patients that are COVID positive has certainly increased fourfold over the last month. And then it's a capacity issue with respect to staffing. And quite frankly, what we've seen is a number of nurses who have made career decisions to do different things. And this is obviously unfortunate, but it is understandable. It's been a year and a half of hell. And a number of nurses have decided to either leave the profession or to go to work in settings that are not quite as difficult or dangerous and that sort of thing. Some have become traveling nurses. Many have, and because of the rate of pay and so forth. There are 6,000 nursing positions open in Louisiana today. Medical providers in our state would hire 6,000 nurses today if they were available. So, if you're out there and you have the requisite degrees and so forth, and you want one of those nursing positions, we do encourage you to get connected with one of these healthcare providers. But we can all do our part, whether we're a nurse or not, by getting a free, safe, and effective shot in the arm. We have covered an awful lot today. I do want to end on a little bit more of a positive note. We do have that increase in people getting vaccinated. It was shown to you on the last slide. My hope and my prayer today is that that slope, that trajectory of increases in vaccinations will continue for a long period of time and be as pronounced as that slope for case growth in Louisiana is for COVID. Because when that happens, you will see that case growth line start to come down. And we know that we are much less likely to have any surges in the future that are really of any consequence. You may remember that a few weeks ago I said that while we were doing better, we were not yet on a one-way road away from the pandemic. That turned out to be very true because we made a U-turn and we're surging again. But we can get going back in the right direction, and we can put ourselves on that one-way road away from the pandemic. But we can't do it for you. You have to make the decision if you've not yet done so. And I'm asking you, if you have previously decided to wait, if you have previously decided that you were just not going to do it, you did that on faulty information, but you also did it without knowledge of what's happening today, here in Louisiana and around the country. take a look at what's happening today. Get the best information that you can get. Make the decision to be vaccinated. The next press conference will likely be next Friday. We don't know the location yet, but we will certainly be letting you all know. And at this point, I will take a few questions. Yes, sir.
With the schools fixing to reopen, are you considering rescinding your mask mandate?
Okay, I wanted to make sure I knew what the question was. So currently, school districts have made the decisions district by district around mask mandates in school. We know what the guidance is coming from the CDC currently with recommendations. We also know what the recommendations are coming from the American Academy of Pediatrics. We are working with our school systems every single day. We're going to continue to watch and see what the CDC does. But whether I impose a statewide mandate or whether this is handled by the school districts, I can assure you that the recommendations will not change between now and when school starts, whether it's K through 12 or really even higher ed. And that is that individuals indoors, unvaccinated, wear a mask. I mean, it really is going to be that simple. It may not be simple to execute, and unfortunately, even if that's the recommendation, if that's what the science supports, you know, in the past at least, we've had individuals who opposed those types of measures. But I'll be working with school leadership. At the present, I don't have any intention of taking the authority away from the locals to make the decision. But at the same time, that decision doesn't have to be made today, and we're going to continue to watch what happens here in Louisiana and what the CDC guidance is, and whether that changes over time. And if you notice, and I think, if I'm not mistaken, I've seen where some governors in some states have already taken things off the table. I am not taking anything off the table, because we are at the beginning of the fourth surge. And how do you take any tools out of the toolbox to address the surge before you know how bad it's going to get? Now, I hope that we don't have to go back and take the same types of actions we've taken previously. But I don't commit that we won't. What I will say is we shouldn't have to. We know what works. If people will do the things we talked about today, we won't have to. But I can't guarantee that that's going to happen. Yes, ma'am.
What do you think football season's going to look like? And I mean, how do you feel about LSU heading to California to play, especially when we're on the list by the White House?
Yeah, you know, the good news is that those football games are outside. And it is true today, like it has been throughout. Any activity outside is much, much safer than that same activity inside. And, you know, I'm hopeful that things like the football season can be conducted safely and as planned. And there may be some minor modifications, and I'm not announcing any here today. But let's just talk about the mask for a moment. It really doesn't even qualify as an inconvenience in light of the good that it does, the protection that it confers upon the wearer and upon others in close proximity to the wearer. And I can enjoy a football game with a mask on. You know, and it may come to that, and it may not. And quite frankly, I don't worry as much about LSU football and most other sporting events that are going to be outdoors. We will be paying very close attention to the Superdome and indoors, because we know that that's inherently a much riskier proposition, right? But we're not there yet. But you know, if people have to wear a mask in order to safely enjoy something, it's not much of a price to pay. If you want to look at a heavy price to pay, go take a look at a COVID unit. Go visit a grieving family. Go talk to a nurse who zipped 3 or 4 body bags that day. That's a heavy price to pay. Anybody? Yes?
In the past, we had surges that were attributed to like holidays, things like that. Is there anything that this is attributed to specifically? Because, I mean, we seem like we have been doing so well for such a long time.
Yeah, it's attributed to the Delta variant. And so we didn't have to have any changes in behavior. We didn't have to have gatherings and events and so forth in order for this to happen because the Delta variant is so much more transmissible. And we believe that it is more virulent as well, and for the same reason. And that is because the viral load that one has when infected by the strain of COVID-19, that is the Delta variant, we believe from early testing that can be 1,000 times the viral load of other strains of COVID-19. That's why individuals are much more likely to infect others, and that's why individuals have more serious cases. And that's also why, to some degree, our experience with COVID-19 up to now is not necessarily what we can expect going forward. That's why we're seeing more younger people who are having serious cases of this virus. So it has been the case more often than not, for example, that the age group spreading a disproportionate amount of COVID-19 was the 18 to 29-year-olds. But in the past, they were spreading it, and it was the 60 and 70 and 80-year-olds who were actually paying the price for that. Now you're seeing many more people in that 18 to 29-year-old group who are spreading it, but also paying the price. And so this is very different. So it is the Delta variant that is the difference now. And quite frankly, it's also because we didn't take full advantage of the time that we had to get a significant percentage of our state vaccinated. And it pains me to say this one, but this one is on us. This surge is on us. How bad it gets, how long it stays bad, how many people ultimately die, on us. You get it.
So you talked about the high turnover rate among healthcare workers, but what about the low vaccination rates? How are you planning to address that?
Yeah. Well, the same way we do in the community at large, and that is through more education and continuing to talk to them. And those numbers too are improving over time. And I do look forward to the day, and I don't know when it's going to come. I believe it will come over the next several weeks, but I don't know that. When full licensure is given to one or more of the vaccines by the FDA. And so what I'm talking about is we're currently operating, as you know, under the emergency use authorization. When that full authorization, that licensure is granted, I believe that you are going to see, at least in terms of polling and anecdotal information, a lot of people will say, well, they're going to wait till then. They're making a mistake with that position. As Dr. Cantor just mentioned, we didn't just have the clinical trials to inform the decision to issue the EUA. Since then, there have been 340 million shots given, with all the surveillance that you can imagine as to how those shots are performing in terms of safety and efficacy. And so I have all the confidence in the world that the EUA will give way to full licensure. When that happens, we believe that people will choose to be vaccinated who haven't chosen to be vaccinated. But But we also look forward to that day because it can be added to the list of vaccines that will become mandatory for K through 12 schools, for higher education and so forth. I think you will then see more institutions, especially medical providers. I think we saw this week where Oxnard announced that as soon as the licensure is granted by the FDA, they will make the vaccine mandatory for their workers. And so I believe we're going to see a large increase in people who are vaccinated when that happens. But I am pleading with people, and I'm praying that they don't wait till then to make the decision to be vaccinated, because that literally could be a month from now, 2 months from now. We don't know. And we have no time to wait. This is a very challenging situation, because I want you to think about how Dr. Kanner talked about this a moment ago. The number of cases and hospitalizations and deaths relative to the number of people fully vaccinated. So if everybody in the state of Louisiana started their vaccination series today who hasn't decided to do that yet, if they got the first shot today, they're getting the second shot either 21 or 28 days later, and you're 2 weeks beyond that before you're fully vaccinated. That's when maximum protection is conferred upon you. So think about that. We're talking about if everybody was standing in line right now to get vaccinated, you're 5, 6 weeks away from that full vaccination. That's why he said the best time for people to be vaccinated was 5 weeks ago. That's what he meant. I'm pleading with people. And I've done it before. And if you didn't listen to me then, look at the circumstances today. Talk to people that you know who are coming out of the hospital, because there's a really good chance that they made a decision not to get the vaccine too. I suspect that will not be their position coming out of the hospital. Or maybe talk to family members of people who died, who chose not to be vaccinated. We can do better. It is entirely within our control. We just have to do it. And when we do it, we are being our best selves. We're being good neighbors. And that's what I'm calling upon the state of Louisiana to do now. So thank you all. I do encourage everyone to lift up our state and all of our people, all our health care providers, those people who are sick and so forth, in prayer, so that we can overcome this in short order with the least possible number of infections and hospitalizations and death. Let's make it happen. Thank you.